Hi, I'm Zack Leman. I'm the lead engineer at Well Health. We are a HIPAA-compliant messaging platform and app ecosystem for healthcare that brings communication between practices and patients together in one place using existing office phone numbers. At a high level, we essentially allow practices to text patients securely and for patients to communicate backwards and enhance that communication. I'm at this conference to speak on a panel to talk about our participation in the Cedars-Sinai and Techstar Healthcare Accelerator. The intersection of design and healthcare, I think, is at a point where a lot of the pain points are becoming very clear, and they're clear burdens to the healthcare system, and a lot of entrepreneurs and tech companies are looking to see how they can go about solving those pain points. And I think it's really important when you're designing a new product to understand, well, if you've identified a pain point, to then actually really get in at the front lines and shadow at a practice or in a clinic and see how people are using the current solutions and where the failures are, and how you can actually develop a product to fill in those gaps and enhance those either communications or procedures. So right now, when practices are trying to reach out to patients, they'll often send mail, like direct mail to people's homes to remind them to show up to an appointment, or they'll send calls or emails. Those communications don't really work most of the time. There's a really low rate of actually opening any of those things or seeing them and actually acting on them. So we solve that problem by allowing the practices to actually send text messages to the patients, and over 90% of those patients get those messages and act on them. They'll come in, there'll be a lot fewer missed appointments, and that's exactly what the practice wants to see. They don't want to lose their business, and this product will really help them. From the panel I was on, I'm hoping that they can see that there's a few models for actually helping small companies identify problems and actually help them interact with the people who are experiencing these problems. So with the Healthcare Accelerator, it actually opened up a lot of potential for us to interact inside of these practices. And without these types of models of innovation, we would be much harder to open those doors and make the progress that we've made in such a short amount of time. So the Healthcare Accelerator really allowed us to meet a lot of people and to interact with a lot of people that work and experience these problems. And without that, we wouldn't have been able to make as much progress. So I think it's really important that people see the benefits of these types of programs, and that there's more of them in the future to allow this type of innovation. I'd say there's a lot to look forward to in the future of healthcare and innovation. I think right now the rate of progress is starting to pick up because some people are fed up with the current system. It's becoming very expensive, and that's really starting to allow to push some innovation at a much faster rate. So I think there's a lot to look forward to, and we should all really try to see how we can make an impact and improve that innovation.